Good morning, and thanks for attending. Today, I'm joined by Dr. Carol Zimbalati, public health physician, to give an update on our local COVID-19 situation, and Andrew McCullen, director of COVID-19 immunization strategy, who will provide an update on the vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in the region. November 1st to 7th is Treaties Recognition Week. It honors the significance of treaties for both Indigenous and non-Indigenous peoples and brings awareness to our collective treaty rights and obligations. I encourage you all to learn more about treaty rights, treaty relationships, and their relevance today. Yesterday, the province announced the expansion of third doses for select groups, including individuals aged 70 and over, born in 1951 or earlier, healthcare workers, and designated essential caregivers in congregate settings, including long-term care home and retirement home staff and designated caregivers. Individuals who received a complete series of viral vector vaccine, 2 doses of the AstraZeneca vaccine or 1 dose of the Janssen vaccine, and First Nations, Inuit, and Métis adults and their non-Indigenous household members. Individuals who fit into these categories must have had their last dose at least 6 months ago, that is 168 days. Anyone who is not at least 168 days from their last dose will not be offered the 3rd dose at this time. On October 7th, adults living in long-term care homes for seniors and other congregate living settings that provide care for seniors, as recommended by the National Advisory Committee on Immunizations on September 28th, became eligible for 3rd doses, and all will have been completed by end of day today. As of Saturday, November 6th, we will once again be offering appointment booking for the COVID-19 vaccine. If you're eligible for a 3rd dose, 2nd, or want your 1st, I recommend you book an appointment. Walk-ins will be welcome, but they should anticipate a longer wait time as demand for vaccine will once again be increased. So with that, I'll pass it on to Dr. Zimbalati to give a local COVID-19 update.
Thank you, Dr. Chirico, and good morning. Last week, Sudbury identified themselves as a COVID-19 hotspot, and we are seeing rising cases in other health unit regions within the province. Last press conference, we declared a workplace outbreak. As of November 2nd, the workplace outbreak is over. But yesterday, we declared an outbreak of COVID-19 at Chartwell Barclay House Retirement Residence. A COVID-19 outbreak is declared in a retirement home when there are 2 or more confirmed cases of COVID-19 in residents, staff, or visitors, and the cases are linked. This situation is evolving and the outbreak investigation is still underway. As of this morning, 23 individuals in total have tested positive for COVID-19. On November 2nd, 2021, the health unit was made aware of an individual who tested positive. Additional infection prevention and control measures were put in place immediately. Case and contact management began, and planning for COVID-19 testing was initiated. On November 3rd, COVID-19 testing was made available to staff and residents of Barclay House through the North Bay Regional Health Centre's Assessment Centre. As the investigation is still underway, out of an abundance of caution, if you have been to Barclay House Retirement Residence between October 20th and November 3rd and have not been contacted by the health unit, please monitor for symptoms of COVID-19. If you feel unwell, isolate immediately and arrange to be tested. We continue to work with Barclay House and the individuals who have tested positive to reach all close contacts and are implementing control measures to prevent further spread. I would like to thank the work of Barclay House and the Assessment Centre for working quickly to offer testing. Case numbers for the outbreak will be updated Monday to Friday through our status report COVID-19 dashboard on our website. We will continue to work with the facility and communicate with the public as required. Now back to you, Dr. Jericho.
Thank you very much, Dr. Simplade, and I'll now pass over to Ms. McClellan. She'll give us an update on our vaccine rollout. Thank you.
Thanks, Dr. Jericho. Good morning, everyone. As of yesterday at 3 p.m., we are now at 87% of residents 12 years of age and older who have received at least one dose of a COVID-19 vaccine, and 83% of residents 12 years of age and older who are fully vaccinated. Currently, the age group with the lowest vaccination rates are those aged 18 to 29 years of age, with only 74% who have had at least one dose and 67% who are fully immunized. That means 26% have yet to receive a dose of COVID vaccine. If you know someone in this age group, I encourage you to have a conversation with them about being vaccinated. They can also call our call center at 1-844-478-1400 if they have any questions. 82% of youth 12 to 17 years of age have received at least one dose of the COVID vaccine, and 75% are fully immunized at this time. As of 3 p.m. yesterday, we have administered a total of 193,328 vaccinations in our district. The current target remains to achieve 90% vaccination rate for both first and second doses. To achieve this, we need to administer an additional 3,835 first doses and second doses to those without a vaccine yet, as well as 4,683 second doses to those who have already had their first dose. We are moving back to appointment-based clinics as more groups become eligible for their third dose of vaccine in an effort to manage wait times and lineups. We encourage everyone to book an appointment online by following the links at /COVID-19.ontario.ca or by calling our call center at 1-844-478-1400. Our call center will be open on Saturday and Sunday this week to assist with booking appointments. Flu shots are also now available in our district. Individuals looking to receive a flu shot should make an appointment with their doctor or primary health care provider or visit a pharmacy. You may also walk into a flu shot clinic put on by the health unit. Since the health unit is now offering COVID vaccines and influenza vaccine clinics, please make sure you're attending the correct clinic. Our flu shot clinics are as follows: November the 5th in Sunbridge from 10 a.m. to 2 p.m. at the SSJ Arena. November the 7th in Parry Sound from 10 a.m. till 2 p.m. at the Stocky Centre. On November 8th in Mattawa from 2 p.m. till 5:30 p.m. at the Mattawa Golden Age Club. On November 10th in Sturgeon Falls from 4 till 6 p.m. at the Marcel Noel Hall, and on November 13th in North Bay from 9 a.m. to 5 p.m. at the Elks Lodge. If you can't make any of these times to get your flu shot at you can get your flu shot at a participating pharmacy through your primary health care provider or by calling the health unit to book an appointment at 1-844-478-1400. Now back to you, Dr. Jericho.
Thank you very much, Mr. McClellan. So that ends our remarks, and we will now take any questions that you might have. Please put them in the left of your box and associate your name with it if possible. And I will try to answer, we all will try to answer as many questions as we can. And if we don't have the answers, we'll get back to you. So I'll turn it over to Alex for the questions, please.
Thank you. Our first question is for Dr. Jericho. It comes from Eric Tashner from CTV News. What are the health unit's thoughts on the Ford government's refusal to make the COVID-19 vaccine mandatory for Ontario hospital workers?
Yeah, thanks for that question, Eric. I thought somebody was going to ask it because it's such a controversial topic. We, on one hand, certainly everybody feels that we have an obligation to patients to protect them and do the utmost that we can to ensure that happens. The government's in a difficult position. There's no question about it. They have to try to find the balance of being able to protect the patients as well as listened to, and they did significant surveys and got feedback on this topic because it is controversial, especially with the hospitals. In some hospitals, I think the feeling was that they were concerned about the staff shortages, which certainly they've been under siege for quite some time, and they need to maintain the ability to care for the patients. So certainly controversial. The Ontario Hospital Association came out very much in favor of mandatory vaccinations. So in the end, this is a decision that they made. I know everybody will work together to do everything possible to ensure the safety of the patients moving forward.
Thank you. Our next question is for Dr. Zimbalati. It comes from Eric Tashner from CTV News. I want to clarify on the outbreak at the Barclay House. Are the 23 cases all at the long-term care?
So the facility is not a long-term care facility. It is a retirement facility, and all of the cases involved are either in staff members or residents of the retirement home. However, I would add, sorry, that the investigation is still ongoing. So there is a possibility that additional cases could be identified over the coming days.
And just a continuation on that question from Richard Coffin at Vista Ribia, North Bay. Are there COVID-19 cases in both employees and residents of Barclay House? And is there a concern about community spread if there were employees impacted?
So certainly there is concern when there is that number of individuals who have tested positive that it could definitely impact the community. So we are really advocating for caution locally, and definitely if anyone has been visiting Barclay House or is a close contact with someone who resides there, works there, then additional caution may be necessary in terms of self-isolating if you do have symptoms, and of course monitoring for symptoms. We would advise anyone who does have symptoms to be tested.
Thank you. Dr. Zimbalati, another question from Eric Tashner at CTV News. What is the status of the vaccination rate at the retirement home?
Yeah, that's a good question. We are still collecting that data, and so that might be available later. We do have information that the vaccination rates are extremely high, both among staff and among residents, but we do not know the exact numbers at this point while the investigation is ongoing. Anything that you would like to add on that, Dr. Chirico?
Just that we're working with the Chartwell home to ensure that all the outbreak measures are being followed. They've been great, cooperative. We certainly have infection prevention and control measures that have been put in place so far. They've done the routine testing of all the residents and staff. There's enhanced symptom monitoring. We've done ensured that they're doing enhanced cleaning, disinfection, and on-site infection prevention control assessments being done. They're enhancing the use of personal protective equipment, and they're using the droplet contact precautions. And there's no communal dining. There's no group events or gatherings, no visitors. And any additional measures that we think might be appropriate are going to be put in place. So lots happening. And I also want to stress too that the vaccination rates being high, and still that when there are cases, and there are breakthrough cases, I think it's important to remember that with public health measures that we've had, as well as the vaccines that we've offered and very high uptake, nothing is 100%. You're always going to get breakthrough cases, but we know that these vaccines are highly effective in preventing severe disease, hospitalizations, and deaths. Could that occur? Yes, it can occur. This is the best protection that can be offered, was offered, and there certainly was a great uptake on that.
I can confirm as well on the vaccination information that on October 31st, our staff attended Barclay House and provided immunizations to the residents of Barclay House, and 58 eligible residents were immunized. I'm not 100% sure on the number who were eligible, but 58 people did receive their vaccine on October 31st, their third dose.
Yes, this is a population that has been identified as one that does have waning immunity and have been a priority in terms of getting third doses in. So that is why the retirement home residents were able to get the third doses, because they are a priority population for these doses. We don't anticipate that in other healthy individuals who have been double vaccinated that there is severe waning of immunity from the vaccines at this point.
Thank you all. Our next question is for Dr. Zimbalani. It comes from Eric Tashner from CTV News. Do we know at this time if the outbreak is due to a COVID-19 variant of concern?
We don't know that information at that point. We only have preliminary results.
What I could add to that as well is that what we do know, Eric, is that within the province, the science table is reporting that over 97% of the tests that have been positive have been with the Delta variant. So we would assume on probability that very likely it would be the Delta variant, because that's the largest number in the province so far.
We will get more information on this in the days to come.
Thank you. Our next question is for Dr. Zimbalani. It comes from PJ at the Nugget. Is there any indication on how many of the residents and staff at the Barclay House have been immunized?
Yeah, that is the important question. And as I mentioned, we believe that the rates are high, but we don't have those exact numbers at this point.
Thank you. So that completes all submitted questions for the press conference. That will end today's press conference. Thank you for everyone who has attended, and we will see you again next time. Thanks.